One of the things we're really striving to help the medical and the public communities understand is that Alzheimer's dementia is just the last stage of a process which has been going on for many years. Before dementia, there's a stage we call mild cognitive impairment, when people have milder difficulties that don't interfere with daily living. And before that, there's a period of time that is probably at least 15 years when Alzheimer's disease is latent in the brain and slowly advancing. That's our opportunity for intervention and prevention. There's a lot of evidence that lifestyle interventions during this latent phase may be helpful. What you do through midlife in terms of your cognitive lifestyle, your aerobic exercise lifestyle, your social connectedness, all play into the success of your brain aging, if you will, and the point at which an Alzheimer process would tip into symptoms. And we think those kinds of factors probably make years of difference in terms of when symptoms would emerge. I think the most successful strategy for curing Alzheimer's disease is to prevent progression to the dementia phase. I think a great analogy is what happens with HIV and AIDS. If you think about it, when's the last time you heard of someone dying of AIDS? There's just as many people as there always were who are HIV positive. Fewer people are dying of AIDS per se because there's a medicine of it. There's several medicines that people take to prevent the clinical manifestations of the HIV infection. In the same way, Alzheimer's disease processes are pretty common in the population, but they don't necessarily have to lead to dementia. And I think the future is intervention in the latent phase of the disease and the prevention of the emergence of dementia. The national goal is to have an effective prevention or cure by 2025. This is something which is now sort of organically built into the NIH budget. The NIH director can recommend appropriation of money over and above the NIH base budget in order to meet this 2025 goal of at least one effective treatment or prevention of Alzheimer's disease by 2025. We can interrupt symptoms, we can replace missing brain chemicals and help people's memory and attention function better, but we haven't yet been able to blunt the natural history of the progression of the disease. There's some interesting data coming out that suggests that in patients with amnestic mild cognitive impairment, which is an early stage of Alzheimer's disease, that the course can be ameliorated or made better by a supplement in which the fish oil is really the main operative agent. So there are some supplements that we think make some sense. They need to be studied with the same rigor that we study new medicines with.